going to turn it over to Michael Reardon.
Hi. All right. Well, thank you, Chairman. Appreciate it. So thank you all very much. We appreciate you guys all getting together for this. Certainly what I'd like to kind of do a collaborative presentation here with Steve. You know, he and I spoke this morning in reference to a number of health insurance related items that, our carrier CDPHP has brought to both myself and to Steve, as well as to Lori Halstead in the office. Lori is on vacation, so Steve and I are going to do our best to kind of muddle through it based on the paperwork that we have. So kind of at this point, we've got 1, 2, 3, 4, 6 different things that we'd like to talk with you about that we are going to need a vote on to decide whether or not we would like for these types of services based on CDPHP's recommendations to be added to our plan. Steve would like to speak with you in reference to behavioral health and substance abuse program that CDPHP is certainly encouraging, and we potentially feel might be a good idea, and certainly in this environment, a very positive benefit for us to add to our county benefits. In addition to, we'll talk briefly about ER Anywhere at Delta Dental, and then I don't know whether or not that requires to go into any type of formal, as long as we're not discussing the actual employee's name, Steve. I don't think when we talk about the very last thing about the claim with the hospital and the doctor, as long as we don't disclose the employee's name, I don't think we have to worry about going executive or anything. So, Steve, why don't I kind of turn this over to you and let you kind of go through the 6, okay? And then certainly if anybody has any questions, if I have any information, we'll kind of chime in together. Okay, is that good?
Sure.
Okay.
Except
right.
I don't know about number 1, COVID
Okay.
vaccine adverse reactions.
Yep, that's okay. That's all right. So CDPHP has come to us certainly with the, sorry about that, Steve, with the COVID vaccine, now pretty prevalent in the population in the United States, having the vaccine. One of the things that they have found is certainly that there is a portion of the population, even as small, that ends up having adverse reactions to the vaccine. So CDPHP is presenting that they would like to know if the county would be interested in waiving the copay, either for the doctor, the emergency room, or the inpatient hospital for any employees or dependents on their plans that experience adverse reactions due to the injection of the COVID vaccine.
Do you want to go through all of them, Michael? Or
that would be great. That would be fine. Okay.
Okay.
Go ahead.
Oh, go ahead. All right. The same thing for the COVID testing copays. They want to know we can currently waive the copays for COVID testing. CDPHP is still waiving copays for their fully insured. And when we say that, it means that that's what they think is the clinically the best thing to do. So waiving the copays for the testing. The third thing is the colon cancer screenings. As you know, the recommendations, well, you may not know, but the recommendations have now been lowered from 50 down to 45. It's being recommended that we follow that guidance from the federal government. Do you want me to jump to 6 and 7, Michael?
Sure, that'd be great. Thank you.
We're going to skip 4 and 5 for a second. Birth control is currently covered by both PROACT and CDPHP. And we brought this up a couple of times before. We didn't have all the facts and figures. Now we seem to have our ducks in a row. What we'd like to do is have all the birth controls covered by both PROACT and CDPHP. We think we get better pricing on some things from PROACT, on some of the birth control. Also, it's a little confusing for the staff, is what Lori has found, is that they'll go to the pharmacy and find that they can't pick up some of the prescriptions that they've been ordered, such as cervical caps, diaphragms, which can, in some instances, be picked up at the pharmacy. So we'd like to be able to have PROACT cover that, just simply for ease of access. So they'd like to be able to go to the local pharmacy and fill those rather than have to go through a doctor or a medical equipment provider, which is another step. So you'd simply show your CDPHP card for coverage. I think it's a really good idea. to do this. This is number 7 is a little more cost comes into it, but again, this has been recommended, and we've been thinking about this for a couple of years. There are glucose monitors, and you've probably seen them, in which people attach them to their arms. There are 2 types. One is the Dexcom, which is one that gives you continual readings on your blood sugars, and you can set alarms that alert you and the doctor that you're in low blood sugar, so that you can react immediately. And this keeps people from doing pricks throughout the day. So particularly helpful for people who work, or people who have very difficult to control blood sugar. That's what's called the Dexcom, and that's about the size of 2 quarters. And it, again, you can set alarms, and it has a continuous reading, so that you have a continuous readout. That comes out to roughly $4,000 for the year. However, they've shown in the cost analysis that actually keeps people out of the hospital and keeps people from going into whatever diabetics go into when they have low blood sugar. So the Dexcom is particularly good for those people who have difficult type 1 diabetes. So for young people especially. Now the second one is not a continuous glucose monitor, but is exactly the same thing. It attaches to your arm. You've probably seen those also. They're basically the size of 1 quarter instead of 2 quarters. They are not continuous, but they are what they call flash meters, meaning you take your iPhone or what's the other one, and you stick it to your arm, and it gives you a reading at that point. So those are for people usually with type 2 diabetes, where they have a more stable blood sugar, but it allows them every 2 or 3 hours to check, so they don't have to do a finger prick. So 2 different types of diabetic, and the recommendations have been for a couple of years that these keep people out of trouble. It also, I think, it helps with adherence, because you probably know some people who do continual finger pricks 5-6 times a day, but there's those people who should be doing finger pricks, but are like, what's one more, shot of whiskey? It's not going to affect my blood sugar. I already have glucose here. It's good for those folks who are not that good at adherence. So our recommendation on the Dexcom and the Freestyle Libre. The Dexcom is about $4,000 a year. The Dexcom Libre is about $70 a month, so less than $1,000 a year. You're going to find that the Freestyle Libre, the less expensive one, is the one that's be used much more. The Dexcom is for the more serious diabetics. So sorry for the long, sales pitch, but this is something that we've been completely convinced makes sense to, and it's something that people are using. So those are the 1, 2, 3, 4, 5.
Mhm.
Was there one more that we wanted to? Did we want to check the ER anything at this point, or is that a different?
We kind of had the cardiac rehab on
Okay.
there as one of the 6, and certainly we can go back through them slowly. And, as Steve and I talked about before, if you need to, if you need more information or some sort of financial information that we can try to get together on any of these, we can certainly do that. There's some of them that, certainly CDPHP is just trying to find out whether this is something we want to, for services that they want to know if we want to continue, we would need an answer on. But for the new programs, we could certainly get information and bring it back to you.
So how does that, excuse me, how does that, the cost, whether it's the $70 a month, which is, $840, or the $4,000, how does that actually work for the county? How does that affect us financially? How does that work? Who pays that? How does that get paid?
We would pay it. I mean, the county would pay it. There'd be a copay. There's a new, and this is an aside, Rob, but there are new diabetic legislation in New York that caps, diabetic costs, I think, at $100 a month at this point. So copays would be capped at $100 a month, but they probably wouldn't be that much anyway. Both of these would probably fall under, and I'm almost certain they would fall under medical equipment. And so since they're not, only the sensors would be considered durable medical equipment, we cover 50% of that. Oh no, actually we have a rider down to 20%. So we would pick up 80% of that cost. So that's how it would cost.
So I'm sorry, again, we would actually pay would the insurance pick it up and we would be picking up a portion of it? Or we would actually pay the whole 80% of the $840?
We would pay the whole.
We
would pay 80% of whatever the, whatever
on
the
top
cost
of the
is.
premiums, we'd be writing a check for the 80% of the
We
$840.
pay for the equipment.
Right.
Just like a prescription drug, Rob.
Right.
So,
Because we're self-insured.
Right.
Brenda.
That was my question, the second part of my question, so I'm fine.
Right. Okay. Yeah, PJ, what do you think?
Yeah, just going back to the COVID, the no deductible for the COVID, do we eat that, or is CDPHP going to share with us and eat that?
It's something that we've paid for all along.
The copay?
It's been a county expense. Yeah, we've been covering copays now for the last year.
But aren't we getting reimbursed for those copays?
We can get reimbursement through the ARPA funds.
This one cycle of ARPA funds, we can get reimbursed. So do any of these result in premium increases?
No, they would not currently. That would have to be negotiated.
Okay.
I think after a year, we wouldn't know what the true cost of the things that I had talked about. The reason they're being recommended by CDPHP and generally being accepted, the glucose monitors, is because they find the compliance is higher and that the long-term cost of paying for these things is less, because one diabetic hospitalization can cost $50,000 to $100,000. So anyway, we don't know how many people would be on the CGMs. We don't know how many people. It's all comes down to medical necessity. So if the doctor thinks it's medically necessary, we would pay for it. Hi, Rob.
Rob?
So, sorry, I need to get more information on this. Is this something we have to offer both of? In other words, we have to offer if you're a serious diabetic or the $70 a month, or you can offer one or the other?
You can offer one or the other. I guess you could put your toe in the water with the type 2 diabetic, which is a much more common diabetic, and the deck, not to get this into this more than you want probably, but the Dexcom is an older system. It's been around for quite a few years now. The prices come down some, so now that's why people are looking at it again, and doctors are recommending it. $4,000 a year is not cheap, but it's cheaper than it used to be. It's about half the price that it used to be. The other type 2, which is more likely used by a type 2 diabetic, has only been around for probably 2 years and has only recently been accepted probably quite readily in the last year or so. And you see it advertised on TV all the time, which might be the reason that people are asking for it. But
And last question, Stephen. Type 1 could use the second unit as well, correct? It's not like they have to use the other unit.
yeah, and the thing about the type, that's exactly right. And the thing about if they're every hour or so, if they were willing to check, or even every 2 hours, in some, depending on their, how their cycle goes, what they recommend with the less expensive one, which is only about $70 a month, what they recommend is if you are toward the lower end of your blood sugar levels, so let's say you go under 100 or under 90, what they recommend is to do a finger prick to get a more reading. So that's how that could be used. So yes, if we wanted to dip our toe in the water, that would probably be the way to do it, and take a longer look and a more detailed look at how many people might be eligible for the Dexcom unit, which is the more expensive one. I will say though, Rob, that the people that are more likely to end up in the hospital are the ones that are probably medically eligible for the first unit. The more expensive ones are the more likely people, more likely to have pediatric, lower adherence, lower compliance to the testing, lower finger prick compliance, kids in school, that sort of thing. So
Thank you.
you're welcome.
So I understood that this year it doesn't result in any premium increases, but do you think it's a step on the road to next year's premium increases?
So if we were seeing any types of increased costs in that, we would certainly be bringing back our total cost expended would come back to the Health Insurance Committee for any type of premium equivalence that could be proposed an increase if that's what was suggested. Because remember, as a part of this, CDPHP and PROACT both kind of serve on that advisory part with Steve to recommend to the county whether or not, based on our current and trending costs, whether there should be a premium increase in those. So now, Steve, were we able to take a look at current information actually related to our direct diabetes numbers? I'm assuming that's where this $4,000 annual came from, just looking at our actual population.
Well, no, 4,000 was per person.
Per person, okay, thank you.
There, this was not a total number.
Okay.
No, we didn't get that information fast enough for us to be able to.
So the reason I ask that is because, certainly as we started the meeting, we were saying there's going to be information that is going to be very easy to put before you. Say, for example, PROACT not having, currently on our PROACT contract for certain sorts of contraception that is being paid for by CDPHP, but not. And by doing that, it could potentially be costing the county more money because it's pushing us to have those things through, through CDPHP, where PROACT could have a lesser price. So that may be something that's very quick and easy. We can say, what do you guys think about it? You vote yes, it's okay. But understanding certainly that as far as the diabetic information is concerned, we can table any of these topics and get together any information that you need in order for us to then come back to you and give you our actual numbers and add that on there. If that would, certainly make it a lot easier.
One of the things that the union correctly requires is that, or I guess the sheriff's contract, not the others. There's always a resistance from the insurance company saying, we're not going to pay for this, we're not going to pay for this. And then after a year or so, they realize, yeah, these things actually work. It's cost effective. The cost analysis benefit is, to the plus side. So we're going to start paying for them. That's how most of it always works. And that's what's happened in the past year. But I think Michael is right, is that we could put together, at least on the Dexcom, see how many type 1 diabetics we have, And again, we're talking mostly young people here, probably. Will probably be young people. And we could find out how many people we think might be eligible for that type of recommendation. Doesn't mean they'll accept it. I know people who like doing the fingerprint because it's exact and they've been doing it for their whole life. They understand it and they prefer to do it that way. It's they don't trust the technology, let me put it that way. So,
Steve,
on the Freestyle Libre, I don't think the cost is in line with the standard, statin drug or something. So I don't see that as something to stand in the way. So my recommendation would be to approve at least that. So you want me to move on to the other stuff, Michael?
Sure. So, I mean, like I said, I think what it comes down to is we've got a couple of things here that we just need to go through to see whether you support adding these additional types of things to our policy, or whether you would like more information. Steve has two things to discuss. Why don't you go into the discussion of that, Steve? Then we can talk about the claim, and then we can go back and just go over very quickly the 6 things that we just talked about and get their responses. How does that sound?
That's great.
Yeah.
There's something that CDPHP has introduced called Apti Health. Basically, what it is it's a virtual mental health service. So instead of having to see someone in person, you're able to do it through this program. There are plenty of doctors that are already offering this, psychiatrists, psychologists. However, their systems vary in their effectiveness. And so what CDPHP has done is gone to a service that has, that specializes in this. The administrative cost is waived, so we don't have to pay for that, and it would be $5 a month for anybody who's an active user. So, plus the cost of the treatment, of course. One of the things that that the online health is, it's a little bit less expensive. I guess I don't have to tell you how heavily mental health is being used now. The biggest problem with mental health that I hear from members is they can't get an appointment. And so appointments are booked, 3+ months out. And so trying to find psychologists were begging for business a few years ago because there were so many of them. Now they have their books completely filled and they can't find space for anybody else. So in some ways, this opens up an avenue for people who need immediate mental health treatment. I know that there's been some talk, even at the county level, of building up or strengthening the mental health offerings. I hate to add additional services because it means more to keep track of and more things to go wrong. But the reason they did this is because we're sort of in a bit of a crisis here as far as mental health goes. And that's the word they use. That's not my word. So it may be heavily used. I don't know. I used to say that the members at Columbia County didn't go to the doctor unless something fell off, but that's just not the case anymore. Is that, as the plan has gotten stronger and, people have come to understand how to use it, they've used it more. So that's part of the reason that we've seen increased utilization. So that's called Apti Health. So the second thing is ER Anywhere. This was basically they were extending emergency room services for COVID. Very little usage last year. They had 2 calls. They're actually dropping the service and they recommend that we do it too. So that my recommendation will just go with what they see in their numbers. So they're dropping the program called ER Anywhere, and they just want to know if we want to drop it too, and I think we should because we don't know. We don't actually know. We're taking their advice in that situation. So two additional programs. The cardiac rehab. You want me to talk about that, Michael?
Sure.
Okay. One more program. One of the things.
Then we'll recap.
One of the things I'll say about working with CDPHP is that they're very aggressive at introducing new programs, and partly it's because they have such buy-in from doctors and facilities in the capital region. You may have read just in the past week that I think they're joining with Community Care to establish these new medical homes in which they're working. Basically, the insurer and the medical provider are hand in glove, so they're not working against each other. They're working to try to bring best outcomes in all situations, and it's almost like they're becoming the same company in some way. So they're going to have staff on site, and this is the future that they see of trying to control costs. And the first step, which was called medical homes, did not get as much traction as they hoped. They dumped a ton of money into it, in which they were actually paying for the technology in each primary care office, $50,000 and above for each. But in this case, they're actually committing millions of dollars, and they're trying to make this a technology-driven solution to bring costs down. This is what CDPHP does. They're just very, very active. So this is why we have so many things on the plate. This one is called cardiac rehab. They want to know if we want to waive the cost of cardiac rehab. Cardiac rehab is a program that allows up to 60 visits after you've had a heart event. And what that means is, let's say you've had a heart attack or a stroke, and you then need to build yourself up physically so that you don't have another one. And we would have had 2 people eligible for if we had it in place this past year. So there's not a lot of risk to the county. Again, CDPHP is recommending that we waive the copays to try to get participation, because what they find is many more people, and I have the numbers, it's like 1 in 14 or something ridiculous, that go back into the hospital if they've not done cardiac rehab. And the numbers are much better, multiple times that, if they have done cardiac rehab. So the idea is we're waiving up to 60 copays for anybody who's had a heart attack or a stroke to do the rehab as an encouragement. So as I said, there's only 2 people that were eligible in this past year. So it's, I don't think there's a lot of risk in it, and it makes a lot of sense to me.
And certainly, just to give you of that, 60 copays at $25 a piece is $1,500. Just to give you a little bit of the cardiac rehab background that was supplied by CDPHP. Participants are 40% less likely to experience another cardiac event when they take part in a cardiac program. The average care of a hospital readmission for a cardiac event is $32,000 a person. That's the average. So it could certainly be more than that. It could be less than that. But this is in reference to individuals who have had heart attacks, heart failure, angioplasty, and heart surgery. Cardiac rehab has been proven to more than double the 5-year life expectancy after one of these events, and improving quality of events. And as I mentioned, participants are 40% less likely to experience another cardiac event with following the cardiac rehab program. So a lot of this has to do with the fact of the prevention. So a $1,500 waiving of copay. So for a $1,500 per individual program. And Steve just said that there were 2 individuals that would have qualified last year. So that would have been a cost of $3,000. So.
Right. And there is another deterrent, and that is the closest cardiac rehab is up at St. Peter's and Albany Med. So the person would have to be motivated to begin with, to get healthy. So.
But also, Michael, isn't the $1,500 a maximum? Because not all rehab would require 60 visits.
Exactly. Yeah.
Right.
Yeah.
Kind of like PT.
Yeah.
Yep, exactly.
So I know this is a lot of programs and kind of throwing them all. I think what happens is a lot of times the healthcare companies, they kind of go through, all right, let's look at what you currently have in place, such as Steve mentioned with the ER Anywhere. When we had come to the committee and asked for ER Anywhere to be implemented, the idea of it was brilliant. you're looking at receiving an emergency room service from the privacy of your home, being able to speak with physicians online, especially with children in the middle of COVID, not going into an emergency room or medical setting and potentially exposing yourself to a more of a potential COVID risk. And the fact that we had 2 calls in an entire year, I'm assuming since CDPHP is making the recommendation to discontinue the service, unfortunately, their calls are reflecting the same lack of usage as well. So that would be one that we would just be asking for everyone to agree upon. Yes, BJ?
Yeah, I would just, I think we need to take a little deeper dive on that. We're in a process right now of bringing on UCM Digital as our telehealth provider into our 911 center, which the agencies are going to use when we're in an overload situation, which is happening as I speak right now. And they are also, the last I knew, they were also the provider for ER Anywhere. So I would take a little deeper dive into that, and they are partnering with CDPHP in doing this. So I think before we opt out, maybe we should just take a little deeper dive and find out, where they're at with that. We wouldn't want to be cutting off our county employees from using a telehealth service, and CDPHP, we just cut it off being reimbursed for it. So
Yeah,
make sure.
but I don't think that, how is that going to change the numbers of the usage? They're just recording how many county employees, even with the amount of education, it's gone into our newsletters. It's mailed to people from CDPHP. It goes in newsletters that come from CDPHP or even from Lori about opportunities and gone. It's been sent to the unions to explain the different opportunity, and only 2 calls have gone. And it doesn't even necessarily, so I don't know how we could necessarily know whether or not that's something that we would have, or could continue to have enrollment. That's my only thing. It's not that the service isn't being offered, it's just it's not being utilized.
Yeah, I would just make sure that this is a completely different service than what we're about to implement.
Okay.
As far as, coverage.
Okay. All right, Steve. I'm sorry.
BJ, why don't I give you a call early next week, and you can tell me the details, and then I can make calls. We'll go around and figure it out that way.
Yeah, and you do realize that our county health department already uses telehealth services, correct?
Mhm.
For mental health.
Yep.
Okay.
Yep. But their telehealth services for billing are different than our employees receiving telehealth services from a physician. So.
Okay, how do we want to proceed with these items?
So if you'd like for us just to generally go through them again and certainly answer any questions and decide whether you feel that they should be added or retracted from the benefits, I think that would be great. Number 1 was COVID vaccine adverse reactions. Currently, we have no information that's been supplied to us in reference to, how many of our individuals actually have received an adverse reaction. That's not been reported to us that's been a problem, but they're saying that as a, certainly as a continuous investment in COVID vaccines, that CDPHP is recommending that we waive the copay for any doctor, ER, inpatient, hospital copays for an individual that has an adverse reaction. I do just want to say that is not something that has come to either, Steve, your office or my office in reference to
No, it's actually just a few days was the first time I heard about it.
Right.
It seems to me like it's kind of a feel-good thing, like don't kick the guy while he's down, unlike some of the other ones which seem to be medically necessary or medically advantageous. So.
Right. Right. So it's not an area of large concern that has been brought to us from staff or through our medical plan. It's just something that CDPHP is recommending for our plan to look at.
And understanding we have low copays. I mean, $250 that gets reimbursed. We already have, assuming someone submits the claim, we already reimburse it. So it's a free hospital visit. The ER is only $50. Inpatient, so it's not a big cost to the patient. Let me put it that way.
Brenda?
So in general, I support anything that's prophylactic, that's going to provide better service up front and lower cost in the future. Do you think that any or all of these are incentives that would make us a better employer, that we would be viewed to having a better insurance plan, a more competitive insurance plan?
Well, I think that these, and Steve, I mean, correct me if I'm wrong. I think that these are not necessarily things that the employee would be attractive to an employee until they were in that situation. That's what I think. I think that, discussing with an employee about a cardiac rehab program would really not mean anything to them unless, God forbid, they required a cardiac rehab program. Then it would be, and that certainly would be something that would be beneficial to the county and would be beneficial to the person if they had some sort of cardiac incident. And then same thing with continuous glucose monitors. On the administrative side, we're certainly going to look at what this is costing our program for the number of employees or their dependents that are that have diabetes. But again, wouldn't necessarily be attractive to someone unless they had that diagnosis. That's the way I see it, Steve. I don't know about you.
I don't want to make the meeting go on longer, but I think the attitude that you have is very different than it has been in past years. In that we tried to stay away from being what we used to call the Statue of Liberty plan, where everybody wants to flee to because we have the best plan. So it used to be the state plan was a little bit better than ours. So anybody who had a spouse on the state plan would go on that. As it turns out, over the years, the state's gotten more aggressive in the percentages that people pay for their insurance, their premiums, plus their plans are not as good as they used to be. And so now the county plan is probably better for most families. Same thing is true with, maybe NISHIP used to be better than us. I don't think it is anymore. And so do we want to attract everybody? The fact is we have a plan that's unbelievably good with incredibly low copays. We haven't raised the copays on the drugs for close to 15 years. It's a 5/20/40, and it's going on, I think, 12, 13 years now that we haven't increased those. Now we have increased the percentages that people pay from 10 to 20% in new hires in some of the contracts. But anyway, it's a concern about, it has to be a balance between what you're talking about, Brenda, and cost. On the other hand, just what you said, I think things like continuous glucose monitors, the birth control stuff, the telehealth for mental health, the colon cancer screenings all have data that supports, better results. So are they huge better results? No, they're marginal better results. 32,000 versus, whatever the cost might be for another cardiac event.
So, Steve, I think we could get more information for the cardiac rehab and the glucose monitors, as well as the discussion with the ER Anywhere, certainly to address PJ's concerns. We could look at that and get more information and have those back to you guys in the next meeting, if that would be okay. I think what we would be required to look at would be, in support of or against the COVID adverse reaction, the COVID testing copays, whether we want to continue to pay those, the colon cancer screening, do we want to drop the plan for a minimum age down to 40? And then just some clarification I have on me. What is happening apparently is medications for certain prescription drugs and contraceptions are excluded under the PRO Act plan. They are covered under the CDPHP contract. What we would like is for them to be available under both contracts. Then that way the member could actually work with our office or work with the membership to actually achieve the lowest cost options. So some of the things that people are on, certain types of contraceptions, implants, emergency and OTC contraceptions, barrier contraceptive products, implantable contraceptions, and IUDs are covered under our PRO Act. They're only through CDPHP. So that's where the confusion comes with what Steve was talking about with, I've got a card for this and I've got a card for that. Where do I go in order to get what? And we're finding that we're still covering these things through CDPHP. When the employee goes that way, we could actually be getting that at less cost for us and less cost for the employee to go through ProAct. But our ProAct contract, the way it is right now, prohibits for those costs to be through that. Correct, Steve?
Yeah, in most cases, I think that's true simply because of volume. Yeah.
Perfect. Okay. So, and then if we could do that, and then we just have a concern that was brought to us through an employee with CDPHP, and we just need to mention that to you because a vote would need to be taken on the payment of a claim.
Okay, we have a member who needed a shoulder replacement, and they did a search for the doctor, and they found that, for a doctor, and they found this doctor in network, and the doctor, called to get, it's not pre-authorization, but it's standard practice to agree, to check to make sure the patient has coverage for that particular procedure. So they checked, and CDPHP said, yes, the doctor is covered, but the facility is not covered. Again, about a month later, the same situation happened just before the surgery, and CDPHP said, yes, the doctor's covered, but the facility is not covered. The doctor went ahead and did the procedure anyway at a cost of roughly $12,000, and CDPHP denied it. At least the facility cost. And so now we have a member who had no idea that the facility was not covered, but the doctor ignored, or at least the billing office, and we don't know what the process was there in office, but the billing office did not inform the doctor that he was not using an in-network, an in-network facility, in-network hospital, or he didn't care. Judging by my experience, I'd say he probably didn't care and just went ahead and did it anyway. We, looking at the number, the $12,000 is about what we think it should cost. However, that's just a guess. We've asked CDPHP to look into what would be the cost if it had been done in an in-network facility, and we haven't gotten that information back yet. The situation here, though, is that the member is not at fault, and the claim will need to be paid in some way. It's I'm afraid of seeing it on the front page of the Times Union that we've denied something for an in-network doctor because of some confusion with the doctor who will throw up his hand and say, I didn't know. And so it's part of our system. It's a sometimes confusing system, but you do have to have all the pieces agreeing, before you get the lowest cost. So I can't recommend whether you pay this now and get it over with, or would you like more information, which I can probably get in the next 2 weeks, to find out what it would have cost for an in-network procedure, and then look at the two together and say, the member's going to have to work this out with the doctor, or CDPHP is going to have to pressure the doctor to accept the lower amount if it is a lower amount. So
are we sure that our member didn't know?
No, because the member looked on the tool and saw that the physician was an in-network provider. So the physician is not the problem. It's where the physician performed the surgery.
Right. So then the second question comes, for me anyway, is I'm not saying we should not pay it, but I don't think we should pay it this quickly. I mean, I think the doctor bears some responsibility here, and I don't know what our process is in regards to a claim that similar to this. How do we dispute that? What do we do as a county? Again, not taking the stand that we're not paying it, but it seems to me that the doctor bears some responsibility here. I mean, we shouldn't just write a check out for that and say, "Oh, forget about it." I mean, there should be some discussion.
So it was only the doctor that got the notification? That they didn't send it to the participant?
Right, and that was the question that both Steve and myself had was, Why was the employee not notified?
Like a
Or-
CC and a letter.
Or our office or Steve's office or something, like someone for us to be able to intervene and to reach out to the employee and to say prior to said surgery, you know, listen, this is something that they're not going to be able to cover. You know, and they are kind of saying that it's the responsibility for prior authorization, but they must also receive in-network outwork. If prior authorization is not obtained, benefit coverage could be denied or reduced. But where would that correspondence go? So I guess we can certainly dive deeper with CDPHP to see that, because we also want to ensure that the, you know, what does it do? Their book of business is that, you know, it's the responsibility of the member to be placed on that list. And by member position, not our employee. They certainly, you know, certainly understand, as far as our stance is concerned, our number one priority will always be our employees. So
I'd just like to recommend that Steve get more information and we can revisit it. I'm not against, you know, doing it, but I think we need more information. And
Brenda
I just
has her
want to
hand up,
say
too.
is, we got like 10 minutes before finance, so.
So, but this is just a quick comment. I agree with both Matt and Rob that we should get more information. But this exact same thing happened to me about 2 years ago with Blue Cross Blue Shield, and eventually Insurance Commission, which I did, and they insisted that Blue Cross Blue Shield pay it. So if we're self-insured, it's probably going to come back to reside with us in the end. But it was exactly the same example. The doctor was in network. His billing office called to qualify, and somehow the distinction was not made. And he did just what Stephen said he would do. He threw up his hands and said, no, this is not my fault. So, but eventually Blue Cross Blue Shield had to pay.
then we want some sort of an assurance as a self-employed, you know, as far as a self-insured plan, what can we do going forward to avoid that? So if they have to put that extra level where we work with the employee, then that's what we want. So.
Can we just move? I mean, I know we only have 10 minutes, so can we just get the ones that we know, or at least vote on those, so that we don't, next meeting, we just have to deal with the ones we're waiting for more?
Sure. So any interest in approving for COVID vaccine adverse reactions to be paid for by the county? It's currently not something we have.
Do you want to make a motion that we approve it? Brenda?
I'm trying to get unmute. Yes, I'll make a motion that we approve it.
Anybody?
I think there's so few of them, honestly, that, you know, just in knowing, working with the county, that I mean, I'm fine with paying it. I mean, because I don't think there's going to be that many. So,
I'll take that as a second.
yes.
All in favor?
Aye.
Opposed?
Okay. COVID testing copays. Currently, the county pays for COVID testing copays as an incentive for individuals to continue to be tested.
I'll make that motion that the county pays for COVID incentive testing. I think it's a good idea.
I'll second.
All in favor?
Aye.
Opposed? Carried.
Reducing the plan's colon cancer screening age from 50 to 45.
Everything I've read or seen on the issue is that, you know, they are recommending that we start doing screenings at 45. So,
Right.
who am I? I would make that motion.
I'll second it.
Frank Zappa would still be alive if he had done it.
All in favor?
Aye.
AptoHealth, more information. Cardiac rehab, more information. Birth control and what is the word they call it? To be covered under both PROACT and CDPHP to be included. Contraceptives to be added to as covered under our prescription PROACT plan to ensure that our employees are able to get the best pricing and availability from both our CDPHP and our RX plan.
I would move that to improve both access and pricing.
I'll second it.
All in favor?
Aye.
Opposed? Carried.
Steve,
The
that's all
rest
I
of the stuff, yep, the rest of the stuff we just have to do a
Thank you.
little more digging and get back to you guys
Perfect.
with our
So Michael, you'll work with Kelly to reschedule a meeting when we need to?
Oh, absolutely. Yes. Thank you, sir.
Okay, motion to adjourn?
I'll
So
make that
moved.
motion.
Second.
All in favor?
Aye.
Thank you. Much
Thank
needed
you
stuff.
all.
Have a good holiday.
Thank you.
Thanks, everyone.
We're on a different call now, right, Kelly? We got to go off and
Correct.
back on.
Finance meeting to order, and we're going to get started. Kelly, you want to bring that up on the other sheets or the other way?
Hold on a minute.
Yeah, you got it. Good afternoon, everyone, by the way.
Hi, Jim Guzzi.
Good afternoon. We could see the resolutions until you started complaining about the size.
Well,
I really got it messed up.
no, actually, I had full board pulled up, so you really didn't want that. You want the
Yeah.
resolution. So
Yeah.
There you go.
Hold on.
That's the
I
one.
was wondering why Patsy's name was on them already.
me too.
Yeah.
I apologize. I'm thinking they were talking.
I was
about-
enjoying it.
Yeah.
I was looking at that. I'm like, I don't know.
Yeah. Sorry, guys.
Okay, we'll get started. Number one, authorization to create and fill one public health nurse using Public Health Corps funding from New York State.
Move it, Morel.
Second, Calera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number two, authorization to increase payments for Adolescent Tobacco Use Prevention Act. Sting,
move that, Chairman.
$20 an hour.
I'll move it. Gary.
Sterling, second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number three, authorization to award funds to the Mental Health Association to support training for first responders.
Move it, Morel.
Sterling. Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Health and Human Services yet, authorization to award funds to Twin County Recovery Services for salary and benefits support for staffing.
Move that, Gary. Second, Calera.
Motion and a second. All in favor?
Aye.
I believe this is
Opposed?
a grant we get from Columbia University.
Right. Number five, authorization to contract with Accent Health Care Services, Inc. to provide training to individuals to become personal care aides.
I'll move it, Calera.
Second, Livonia.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 5A, Health and Human Services. Authorization for the of the aging to renew standard contracts with various providers. And it is a list of them.
I'll move
All
that.
Livonia.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Okay. Number 6, request authorization to fill one caseworker position, grade 515, base salary at $55,293. Any backfills created therefrom.
Move it, Calera.
Sterling.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 7, request authorization from the Chairman of the Board of Supervisors to fill one Child Support Specialist position, grade 12A, base salary $45,158, and any backfills created therefrom. And this is also from an employee's passing in January.
Move it, Morel.
Second, Livonia.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 8, request authorization from the Chairman of the Board of Supervisors to convert one clerk typist position, grade 10.5, to one community services aide position, grade 10.5, at a base salary of $37,327, and any backfills created therefrom.
Move it, Calera.
Sterling, second.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 9, request authorization for the Chairman of the Board of Supervisors to enter into an agreement on behalf of the Columbia County Department of Social Services with Melanie Miller for the provision of mental health services, assessment, and counseling for identified families and individuals.
Move it, Morel.
Sterling, Second.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 10, still in Health and Human Services. Request authorization for the Chairman of the Board of Supervisors to enter into an agreement on behalf of the Columbia County Department of Social Services with Norma Shook for the provision of consultant services.
Sterling.
Second, Ligonia.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 11, request authorization from the Chairman of the Board of Supervisors to approve the purchase and installation of a two-way talk-through window for the DSS lobby.
Move that, Bury.
I'll second it.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 12, authorization for DHS to accept on behalf of Columbia County one-time Office of Mental Health Workforce Grant Award of $60,000.
Sterling.
Burrell, second.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 13, authorization for DHS to accept on behalf of Columbia County one-time Oasis Workforce Grant Award of approximately $21,500.
I'll move it, Ligonia.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 14, authorization to amend the Department of Human Services 2022 budget and contracts due to approved 2021 COLAs.
Move it, Burrell.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 15, authorization for the Department of Human Services to fill a vacant 1.0 nurse practitioner with either a grade 28C nurse practitioner or potentially a grade 31C senior nurse practitioner, waiving the step process.
Sterling.
Burrell, second.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 16, authorization to renew contract with Cathode Ray Media to pay 50% share of Columbia Green Addiction Coalition CGAC website maintenance fee.
Move it, Burrell.
We have a second?
Well, second it.
Okay.
I think Rob made the motion.
Okay, motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 17, authorization to renew the existing Upper Hudson Planned Parenthood Department of Human Services contract, which includes psychiatric consultation services and social work supervision consultation.
Move that, Bury.
Sterling. Second.
Motion and a second. All in favor?
Aye.
Opposed? Okay. Number 18, authorization for the Board of Supervisors to contract with Columbia Memorial Health for psychiatric consultation services by Admin Abelmaid, MD, on behalf of the Department of Human Services Clinic.
Move it,
I'll move
Scalera.
it.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 19, authorization for the Board of Supervisors to recontract with Columbia Green Community College on behalf of the Department of Human Services for provision of on-site mental health services.
I'll move it. Sterling.
Second, Bury.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 20, authorization for the Department of Human Services to re-enter into a contract with Coordinated Care Services, Inc. on a limited basis not to exceed $4,500 for 2022 financial consulting.
So,
Consulting.
I'll move it, Scalera.
Second, Ligonia.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 21. Authorization for the Board of Supervisors to renew Chatham Central School District's Wellness Campaign contract on behalf of Department of Human Services.
Move
Move
it.
it, Morel.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 22, Public Safety. Resolution request. Request authorization for the Director of 911 to accept the FY 2020 statewide interoperable communications grant totaling $454,749 and disperse in accordance with state home and emergency services guidelines. No match required. Budget requested for 2022.
Move that, Uri.
Sterling, second.
Motion and a second. All in favor?
Aye.
Opposed? Guess that's for the radios, right?
Yes.
Okay, 23, authorization to appoint a member to the Traffic Safety Board. I believe that's Paul Johns, isn't it?
Yep. I'll move it, Morel.
Second, Ligonia.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 24, County Government, authorization for the Managed Information System Department to renew a one-year maintenance agreement with Network Craze.
I'll move it, Scalera.
I'll second it.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 25, authorization to appoint a member to the Columbia County Planning Board for Region Number 1.
I'll move it.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 26, authorization to appoint a member to the Columbia County Planning Board for Region Number 2.
I'll move it.
Second.
Motion and a second. All in favor?
Aye.
Opposed? Carried. That Tim Stalker, is he still the chair now?
Yes, as far as I know, he is. I think he was going to continue there.
Yeah. Okay, number 27, authorization to appoint the at-large member to the Columbia County Planning Board.
I'll move it, Morel.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 28, authorization for the Chairman of the Board of Supervisors to enter into a contract with GAR Associates, LLS, for evaluation services pertaining to 2023 town revals.
I'll move that.
Second, Scalera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 29, authorization for the officials designated to approve New York State real property tax law correction of errors less than $2,500.
Move that, Uri. Second.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 30, Public Works, authorization to fill one position of road foreman and any vacancies created therefrom in the Highway Department upon the retirement of a present foreman at the grade 2022 15 base salary of $55,293. The salary level contingent upon the length of county service of the appointee.
Move it, Morel.
Second, Rick.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Number 31, authorization to fill one budgeted vacant position of motor equipment operator 2 in the Highway Department and any vacancies therefrom at the 2021 grade 12C base salary of $47,005. Salary level contingent upon the years of county services of the appointee.
I'll
This
move
is
it.
resignation.
Yeah. Second, Scalera.
Motion and a second. All in favor?
Aye.
Opposed? Carried. Authorization to fill one part-time laborer, grade 2, in the solid waste department at a step 1 hourly rate of $16.51. This is also due to resignation.
I'll move it.
Second.
Motion and a second, all in favor?
Aye.
Opposed? Carried. Number 33, Columbia County Solid Waste Department, in coordination with the Columbia County Climate Smart Task Force, reintroduced the recycling initiatives to the municipal buildings. New cycling receptacles were placed in municipal buildings with corresponding educational signage.
I'll move it.
Second.
We have a motion and a second. All in favor?
Aye.
Opposed? Carried. Number 34, due to a resignation, we are requesting to fill one vacant budgeted part-time labor position, grade 2.
Move it.
Second, Rick.
Motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. Number 35, authorization to appoint a Commissioner of Public Works.
I'll move that.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. This is Raymond Jakowski.
Yep.
Yes.
Okay, number 36. Resolution is requested authorizing the chairman of the Columbia County Board of Supervisors to execute a professional services agreement with Ryan Briggs Clark Davis Engineering and Surveying of Clifton Park in the amount of $16,700 plus reimbursable expenses for the performance of a level 1 load rating on Stuyvesant Fall Bridge, carrying CR 25A, County Route 25A over to Kinderhook Creek, town of Stuyvesant.
I'll move it, Morel.
I'll second it.
Motion. Number.
Aye.
Opposed? Carried. Number 37 in finance, authorization to fill one vacant purchasing agent due to retirement at December 31st, 2021 in Central Services.
Move it, Morel.
I'll second.
Motion and a second, all in favor?
Aye.
Excuse me, opposed? Carried. Number 38, authorization to award the bid for meat products to Ginsberg Foods and Worley's Foods, Inc. for the period January 1st, 2022 through February 28th, 2022.
I'll move it. Ligonia.
Second, Rick.
Motion and a second, all in favor?
Aye.
Opposed? Carried. Number 39, authorization to award the bid for milk and dairy products, both fresh portion Part 1 and frozen portion Part 2, to Sickway Creamery for the period January 1st, 2022 through December 31st, 2022.
Move it, Morel.
Sterling.
Motion and second, all in favor?
Aye.
Opposed? Carried. Number 40, authorization to award the bid for bread and baked goods to Bimbo Bakeries for the period January 1st, 2022 through December 31st, 2022.
I'll move it.
Sterling.
Motion and a second, all in favor?
Aye.
Opposed? Carried. Number 41, authorization for the chairman of the Columbia County Board of Supervisors to enter into a one-year extension of contract with WB Mason, Inc. for water dispenser, rental, and delivery of bottled water for the period January 1st, 2022 through December 31st, 2022.
I'll move it. Scalera.
Second, Ligonia.
Motion and a second, all in favor?
Aye.
Aye.
Opposed? Carried. Number 42, County Government. Resolution authorizing removal of Reliance Trust Company as trustee. A appointment of State Street Bank and Trust Company as successor trustee, removal of Mass Mutual and Power as service provider, and appointment of Nationwide as success service provider of County of Columbia, New York State Deferred Compensation Plan.
Move it, Morel.
Second, Scalera.
Motion and a second, all in favor?
Aye.
Opposed? Carried. Okay, this is the 2022 EMS chargebacks. Resolved that the following sums be returned to the respective towns, Town of Columbia, County of Columbia, as the 2022 EMS chargebacks.
Move that, Euring.
Second, Livonia.
Motion and a second, all in favor?
Aye.
Aye.
Opposed? Carried. Number 44, authorizing the 2022 combined chargebacks for assessment and tax roll material, erroneous assessments, and small claim items.
I'll
Move
move
it,
it.
Morel.
Second.
Motion and a second, all in favor?
Aye.
Opposed? Carried. Number 45, authorization to enter into a contract for consultant services.
This is for Ron
Yes.
Caponera. to
Okay.
consult, during the transition to our new controller.
Right, that's what I thought this was, okay.
And it's a maximum of $6,000 at $125 an hour. And I believe, I'm not sure, I think the term is no longer than 6 months.
Mhm.
If it needs to be longer, we'd have to come back to the board to revisit it.
Well, it's just $6,000, so it's not.
I'll move that.
I'll second it, Euring.
Motion and a second, all in favor?
Aye.
Opposed? Carried.
That's the last resolution.
That was it?
Yep.
Okay. Is there anyone else that would like to bring anything before the Finance Committee?
I believe PJ had a, proposal, PJ, right? You wanted to go over?
Yeah, you wanna pull it up, Kelly?
Yeah, just give me 1 sec. I have to get out of one thing and get into another.
Cash flow update, that's all.
Okay.
I always like to.
I was wondering.
All right, what you see before you is our actual cash flow projections moving forward until the end of March. This is actually based on our core operating accounts, and it does include our tax stabilization account. This is just out of the general fund. This does not include other funds like road fund, solid waste, so on and so forth. This is what I always use to determine available cash that we should have on hand and what we have available to use. As you can see, the prior year actual is actually in yellow, and that shows exactly where we were. The forecast is the blue line, which shows a healthy increase of which you've seen all along, in part due to the obviously sales tax increase we've been experiencing, as well as some other factors, which shows a healthy outlook as far as our cash flow goes. So as a result of this, I use this to try to invest some funds in some CDs or whatever else is available out there. We have approximately 13 million in savings accounts now that are yielding about 0.30%. What we're looking to do is possibly move another 5 million into some sort of a larger investment with a little bit greater interest bearing. And I have to tell you, it's kind of disappointing. We put out a request to 29 banks. That's 29 banks. We received a proposal back from 2. And their proposals 6 months at 0.10 to 18 months at 0.3, or excuse me, 24 months at 0.35. So we're going to be evaluating that. See, we may stagger some. I don't really want to put money away for a long time, but because not knowing exactly what's going to happen here in the marketplace. But 0.12 at the Bank of Greene County, so we can use some of these funds, and even if we can double that, get like 0.25 or somewhere in that vicinity, it's kind of like doubling it for at least 6 months. So we'll be evaluating that and hopefully make a move here pretty soon with something. And if anybody has that crystal ball, please be sure to telephone me as soon as you know what's going to happen here in the future.
Yeah, we're not sure if these rates, the interest rates, these bank rates are going to go up a tad with the way things are going or not. I was reading about it, so it's maybe if we have that, if we have extra money, which we kind of worked in already. So I mean, to try to use it to pay down some other debt. I don't know right now if it's worth it. We're better off to hold off and see where we are. I think long term.
This does not include the tax stabilization fund.
Right.
The ARPA funds. This does not include the ARPA funds.
Right.
Okay,
Well,
so that's where we are.
But PJ, they're not charging us to hold the money just yet, but that's coming.
I don't think we're too far away from it, Ron.
It sure isn't. No, I tell you about it.
That's the next step, Ron. If
I
we're
know.
gonna-
I'm scared, but I've heard from bankers they're considering it. So
Yeah, I know.
Yeah.
Oh, well. Anyone else have anything else they'd like to bring to the committee?
Yes, I would, Mr. Chairman. As you all know, we had passed a resolution request through the Public Safety Committee regarding separating the Emergency Management Office from the Sheriff's Department. We're going to give that some more time. I'm actually going to schedule a special meeting of the full board in December, so that, we can explain the reasoning behind it and also answer any and all questions that the supervisors may have. We're inviting Sheriff-elect Kraft and his undersheriff to this meeting as well. And I will say that we've been meeting on we've had 3 meetings, basically 2 scheduled and 1 impromptu meeting with the sheriff-elect to continue the discussion around this issue.
Okay. That's a good move. Yeah.
So.
Okay. There isn't anything else to bring before. I'd like to wish everyone a very nice Turkey Day tomorrow. Happy Thanksgiving, and motion to adjourn.
I'll make that motion. Happy holidays to everyone.
Second.
Motion
Yes.
second. All in favor?
aye.
Thanks,
Happy
everyone.